Hello, YouTube. This is Jaimie, and this is Mindfulness Monday. Today, we pause to recognize Seasonal Depression Awareness Month. According to Mayo Clinic, seasonal affective disorder is a type of depression that's related to changes in seasons. Seasonal affective disorder begins and ends at about the same times every year. If you're like most people with seasonal affective disorder, your symptoms start in the fall and continue until the winter months, sapping your energy and making you feel moody. These symptoms often resolve during the spring and summer months. Less often, seasonal affective disorder causes depression in the spring or early summer and resolves during the fall or winter months. Treatment for SAD could include light therapy, phototherapy, psychotherapy, and medications. Symptoms of seasonal affective disorder may be feeling listless, sad, and down most of the day, nearly every day, losing interest in activities you once enjoyed, having low energy and feeling sluggish, having problems with sleeping too much, experiencing carbohydrate cravings, overeating and weight gain, having difficulty concentrating, feeling hopeless, worthy, or guilty, having thoughts of not wanting to live. In the fall, specific symptoms could look like oversleeping, appetite changes, especially for a craving for foods high in carbohydrates, weight gain, tiredness, or low energy. In the spring and summer, symptoms can look like trouble sleeping or insomnia, poor appetite, weight loss, agitation or anxiety, and increased irritability. When it's time to see a doctor is if you've noticed for days at a time you can't seem to get motivated to do activities you normally enjoy. You may see your healthcare provider, and especially it's important if you've noticed that your sleep patterns and appetite has changed and you turn to alcohol for comfort or relaxation, or if you feel hopeless or think about suicide. There are causes to seasonal affective disorder, although the specific cause is unknown. Some factors could be your biological clock or your circadian rhythm. A drop in serotonin, a brain chemical that affects mood, may play a role in seasonal affective disorder, and melatonin levels. The change in season can disrupt the balance of the body's level of melatonin, which plays a role in sleep patterns and mood. Risk factors for seasonal affective disorder can look like family history of people with seasonal affective disorder, having a major depression or bipolar disorder, living far from the equator. So seasonal affective disorder appears to be more common among people who live far north or south of the equator. This may be due to decreased sunlight during the winter and longer days during the summer months, or also a lower level of vitamin D. Some vitamin D is produced in the skin when it's exposed in the sunlight. Vitamin D can help to boost serotonin activity. Less sunlight and not getting enough vitamin D from foods and other sources may be a result in levels of vitamin D in the body. And think about how relevant this is to many of us who may be working from home now during the pandemic. So according to MayoClinic.org, there's no known way to prevent the development of seasonal affective disorders. However, if you take steps early on to manage symptoms, you may be able to prevent them from being worse over time. And if you remember, some of the treatments for SAD may include light therapy, phototherapy, psychotherapy, and medications. Psychotherapy is one of the proven ways to help you to cope with seasonal depression. And so another way that you can cope while seeing a therapist is practicing mindfulness. And today we're going to talk about the Mindfulness Foundational Principle of letting go. I want you to take a look at these flowers here. Well, they used to be white and green. A field of green is now turned into a field of browns. And think about that you know and anticipate that the season is going to change every year. But think about the beauty that comes in that change from summer to fall. The beautiful reds and auburns and oranges and yellows. And the browns that we know and we've expected to change. How can we cope and become more resilient with change and letting go and seeing the beauty of it? Today, I'm going to give a mindful talk from John Kabat-Zinn, who coined the term and practice of mindfulness-based stress reduction. This excerpt comes from Full Catastrophic Living, Using the Wisdom of Your Body to Face Pain in 2013. So they say that in India, there is a particular clever way of catching monkeys. As the story goes, hunters will cut a hole in a coconut that is just big enough for a monkey to put in its hand. Then they'll drill 2 smaller holes in the other end, pass a wire through, and secure the coconut to the base of the tree. Then they put a banana inside the coconut and hide. The monkey comes down, puts his hand in, and takes hold of the banana. The hole is crafted so that the open hand can go in, but the fist cannot go out. All the monkey has to do to be free is to let go of the banana. But it seems most monkeys cannot let go. Often, our minds get caught in very much the same way, in spite of our intelligence. For this reason, cultivating the attitude of letting go or non-attachment is fundamental to the practice of mindfulness. When we start paying attention to our inner experience, we rapidly discover that there are certain thoughts, feelings, and situations that the mind seems to want to hold on to. If they are pleasant, we try to prolong these thoughts or feelings or situations, stretch them out, or conjure them up again and again. Similarly, there are many thoughts and feelings and experiences that we try to get rid of or prevent and protect ourselves from having because they're unpleasant, painful, and frightening in one way or the other. In the meditation practice, we intentionally put aside the tendency to elevate some aspects of our experience and to reject others. Instead, we just let our experience be what it is and practice observing it from moment to moment. Letting go is a way of letting things be, of accepting things as they are. When we observe our own mind, grasping and pushing away, we remind ourselves to let go of those impulses on purpose, just to see what will happen if we do. When we find ourselves judging our experience, we let go of those judging thoughts. We recognize them and we don't just pursue them any further. We let them be, and in doing so, we let them go. Similarly, when thoughts of the past or the future come up, we let go of them. We just watch. If we find it particularly difficult to let go of something because it has a strong hold over our mind, we can direct our attention to what holding on feels like. Holding on is the opposite of letting go. We can become an expert on our own attachments, whatever they may be and their consequences in our lives, as well as how it feels in those moments when we finally do let go and what the consequences of that are. Being willing to look at the ways we hold on ultimately shows us a lot about the experience of the opposite. So whether we are successful in letting go or not, mindfulness continues to teach us if we are willing to look. Letting go is not such a foreign experience. We do it every night when we go to sleep. We lie down on a padded surface with the lights out in a quiet place, and we let go of our mind and body. If you can't let go, you can't go to sleep. Most of us have experienced time when the mind would just not shut down when we got into bed. This is one of the first signs of elevated stress. At these times, we may be unable to free ourselves from certain thoughts because our involvement in them is just too powerful. If we try to force ourselves to sleep, it just makes things worse. So if you can go to sleep, you are already an expert in letting go. Now you just need to practice applying this skill in waking situations as well. So let's check in today. We are in the midst of the holiday season, a time that can be bittersweet for some. It may be a time of joy and happiness, or it may be a time of loss, reflecting on a loss around the holidays. Do you meet for any risk factors for seasonal affective disorder, such as having a family history of seasonal affective disorder, having major depression or bipolar disorder, living far from the equator, low levels of vitamin D? Are you in contact with a therapist who can help? There are many qualified therapists at Nashville Emotional Wellness who can support you with cognitive behavioral therapy, trauma therapy. In mindfulness, there are resources such as Insight Timer, focusing on letting go and coping with the discomfort of change. There are resources Today, we pause to recognize Seasonal Depression Awareness Month. You are supported. There is help. We are real people serving real people with real problems, and we're here to help. This is Jaimie. This is Mindfulness Monday. Thank you.